We're celebrating healthcare careers in Macon County, and today we have with us Dr. Nicole Florence. Welcome.
Thank you.
Okay, so tell us what you do.
Well, so I currently am a medical director in what we call bariatrician for Memorial's Wellness Center. So my job is to help people get healthier, hopefully prevent disease, as well as intervene if they have a disease, and hopefully improve the quality as well as the quantity of their life.
Excellent. So what kind of training did you have to become a bariatrician?
So I went through my 4 years of college. I went to medical school for 4 years. Then after that, we do kind of an on-the-job training, which is residency. Mine was approximately 4 years.
Okay.
I decided to do primary care for about 20 years. And when I decided to become a bariatrician, it was a little different. It was more experience, there was study, conferences, hours, different things, and then you sit for a test and you're ready to go.
Excellent. So really, I think one of the great things about healthcare careers is that they're stackable, right? So it sounds like you were in, family practice or primary care?
Yeah, so I did primary care, and I took care of the babies when they were born, and I took care of them all the way up through adulthood. So I had generations of families that I took care of for approximately 20 years.
So then what made you decide to go from family care and primary care to being specialized?
And I loved primary care, but one thing I noticed is a lot of the conversations I was having with my patients really started to be around, okay, how can we, help you lose weight? How can we make changes in how you're eating and how you're moving to improve your health? And it really became a really big focus of my patient care, that it seemed to be kind of a natural transition for me to start doing this full time.
Excellent. So I think that's really neat that, you went into your primary care, went into something very specialized, but I think that really shows that there's a lot of areas of healthcare to practice.
Absolutely. And even now, we have a culinary medicine program. So it's a program that's really geared around healthy eating and food as medicine. So that's even a newer area than what, was available when I started.
That's very cool. So what does your day-to-day look like?
So what's great is no day is the same. I would get a little tired of the day in and day out, same thing. So all of my days are different. I see patients in the hospital after they've had a bariatric surgery. I also see patients in my clinic. And it may be that I have a patient that's really sick, in a wheelchair. We're trying to help them feel better and move better, but I might also have a patient who's pretty active, but still just needs to tweak some changes in their day-to-day life. So every day is completely different.
Now, thinking about when you were a kid, did you know you always wanted to be in healthcare?
So I was pretty lucky. I've always known, and I was a pretty bad asthmatic child. And I remember my doctor just giving me that shot of steroid, and I felt so good and I felt better. And I thought to myself, man, if I can help people who are sick feel that much better, that would be an incredible profession to be a part of.
Oh, that's wonderful. Very cool. Okay, so what advice would you give to, let's say, a junior high or high school student that maybe they're just not sure what they want to do, but maybe has some interest in healthcare?
So I would say, if you're really thinking about it, try to find an experience that you can really kind of get more immersed in it to see if it's right for you. I actually took a year off after college, and I drew blood for a year at the hospital. And it was one of the greater experiences I had, just to make sure this is what I wanted to do. So I think if you have different mentors or programs where you could kind of get a feel for some of the different things you want to do, I would say go for it. Try them all so you can really figure out what is going to be the best fit for you.
That's a great idea. And I know that professionals and adults love to share what they do, right? Job shadowing, I think, can be really important, like you said, to learn very much what you want to do, and sometimes even what you don't want to do.
Exactly. You don't want to find that out too late, right?
That's right, especially with all the schooling that you have to go through.
You could be so invested and then really find out it's not the right fit. So I would definitely take any opportunities you can to kind of figure that out beforehand.
Fantastic. Love the advice. Love your story. Thank you for sharing it with us today.